Bismillah, let's have a look at the heart anatomy and how we can link this into cardiology. What this series is going to start off is going to be an introduction to the basic heart anatomy, from which we're then going to talk about the vessels, the valves, as well as the different chambers, and trying to apply a bit more of a clinical relevance. For this first episode, however, let's have a look specifically at the heart anatomy and learn a bit more about it. So, in terms of heart anatomy, we can see that there's a few things that's going to consist of it. Of course, there's a lot that I haven't drawn yet, however, I'll start drawing it as we go through. We'll see how long this whiteboard pen lasts. So, firstly, we have the general heart. Of course, you can draw the more detailed version, however, due to my lack of experience in art, we're going to pretend that this is sufficient. So, here we have our heart, here we have our lungs as well. Now, firstly, in terms of the heart, we're going to try to label the four main chambers of the heart. Now, in terms of the chambers, on top you have your atrium. So here you have your right atrium, because of course this is going to be the right, this is going to be the left. Now, in terms of the atrium, so here you have your right atrium. On this side you have your left atrium. Now, on the bottom you have your ventricles. So again, we'll label those again. So here you have your right ventricle. Here you have your left ventricle. I'm just going to shorten it for the sake of time and space. Now, that is our four chambers of the heart. So in terms of the heart, I want you to remember the rule of four. So we have our four chambers of the heart. Now, this is when you're drawing the heart. Next thing we're going to look at is going to be the four main vessels, or the four main, essentially, categories of vessels. So with the heart as well, it's important for me to note firstly that the heart itself is a muscle. Now, with every muscle, what do you need to do? You need to supply it with nutrients, with oxygen. Now, for that, the heart has special vessels itself to supply blood to itself, and these are called the coronary arteries and the coronary vessels. So I'm going to be talking a bit more about those in future videos. However, to start off with, let's focus on the main four vessels themselves, okay? Or the four main categories. Now, firstly, let's start off step one. What is happening? Here, again, let's see how much my pen lasts, but let's say, for example, we have Bob. Bob appears to have a slightly disproportional body, and this is going to be his legs, again, for the sake of my whiteboard pen. So, this is Bob. Let's just pretend Bob has a little face over here. So, what's going to happen? All your different vessels, or your different, all the blood supply from your legs and so forth, is going to be coming up into your right atrium. Your right atrium is your starting point. So, the right atrium, we have your vena cava. Your vena cava, it is a vein. You have the V for vein, okay? Now, that is the vein going into your right atrium. And it's important to note with veins, they go towards the heart. Now, you can hear that I've added a V side, added a bit of a V emphasis in toward. You can see, it's either up to you. So you can either say veins go into the heart, they're in. That's what some people like. Me personally, I prefer to say toward the heart. It's just clicked for me now. It's been a few years of me using that technique. So now with the vena cava, it's split into two parts of it. You have your superior vena cava and you have your inferior vena cava as well. So here, let's just say, for the sake of drawing it, here you have your superior and you have your inferior as well. And this is bringing blood, like I said, toward the heart, okay? So, it is entering into your right atrium. Now, think about this. Think to yourself, is it oxygenated or deoxygenated? You can pause a second, or you can pause the video for a second, have a think. Now, let's answer that question. It is arriving from the rest of the vessel, or arriving from the rest of the body. The oxygen and the nutrients have all been used up because they've been used in the rest of the body. Now we're arriving back in the right atrium. It is now deoxygenated blood. So we're in the right atrium. What is going to happen next? We need to move. Where are we going to move? Now, in terms of the contraction and so forth, again, I'm going to be talking about this, inshallah, God willing, in a future video. For now, we're just talking about the basic anatomy. So where is it going to be going? It is now pooling up in the right atrium. It is going to enter through a valve into the right ventricle. I'll talk about the valve in a second. It's now entered into the right ventricle, okay? Where is it going next? The next place it's going to go is it wants to now go to the lungs. How is it going to get to the lungs? We're going to get to the lungs by going through a vessel. Now, here we talked about your veins. We said they go toward the heart. Now, your ventricles. Your ventricles are going to pump blood out through a vessel. This vessel is called your pulmonary, pulmonary trunk, okay? So your pulmonary trunk, let's see how much space I've got here. Let's go over here. This is your pulmonary trunk over here. Your pulmonary trunk splits into your two vessels, which is going to be your right and your left pulmonary artery. They're going away from the heart. So I'll just kind of draw that here. And it's going to go off into your right and your left lungs. Probably goes a bit more this way, but just for the sake of space, I'll just leave it like that. So Now what's happened? Your deoxygenated blood, which is on the right side of the heart, it's now gone up to the lungs. Happy days. We're now getting it oxygenated. Great. Now what's going to happen next? We're going to go back into the left atrium now. How are we going to get there? We're going to be going through, let's think now, is it going to be an artery or a vein? We're going towards the heart now. We're going back from the lungs towards the heart. The V we're emphasizing. Why? Because it's a vein. It is your pulmonary vein. Now with your pulmonary veins, you have 4 main veins, two from each of the lungs. For the sake of drawing this, maybe I'll just draw a few lines. Let's just say that's 1 each. Same here. They'll kind of go here, 1 each. Great. And they'd more so, they'd go straight into your lungs. So straight into your left atrium. Actually, just for the sake of, let's just draw the other 2. Great. And let's just pretend there's another one here. Perfect. Now this is slightly getting a bit chaotic, but we'll see as we go along. Now, let's just say the blood is now in the left atrium. Great. What is the blood? It is oxygenated blood. We're now in the left atrium. Where do you want to go next? We want to go into your left ventricle. Now, great, there's a valve. We'll talk about the valve in a second. We're now in the left ventricle. Where are we going now? We're now going to go to the rest of the body. So it's important to emphasize as well. I should have emphasized a bit at the start. But we have your 2 main circulation types. We have your systemic circulation, which is talking about how we're going to go to the rest of the body. We're going to the rest of the system. Then you have your pulmonary circulation, which pulmonary, you think of the lungs. We're talking more about the blood and the movement of blood in regards to the lungs. So we've just come back from your pulmonary circulation. Great. Now where are we going? We're going off to the systemic circulation. Okay. So where am I going to draw the aorta? We'll see. But your left ventricle, it is now going to leave via your aorta. Think to yourself, is the aorta a vein or is it an artery? The A, you think of artery, it is going away from the heart. Okay. So this is going to go off to the rest of Bob's body and so forth. So let's just draw it out here. Slightly chaotic, but we'll get through it. So we've now this vessel here. We're now leaving the left ventricle off to your systemic circulation, the rest of the body. So I said that there were 4 main, or the rule of 4. So you've got 4 chambers: right atrium, right ventricle, left atrium, left ventricle. Great, happy days. Next thing, we've talked about the 4 main categories of vessels: your vena cava, pulmonary trunk, going off to your pulmonary arteries. Then you come back via your, just generally your pulmonary veins. Veins go toward the heart. Finally, left ventricle, you're off via the aorta. Great. 4 chambers, 4 vessels. Now, final thing, the 4 valves. Okay. Now, for this, I like to think of the rule, or just I like to call it TPAM. Way to think about it is, so you have. Let's first think about where the valves are. Have I got a different pen? Nope, that's a permanent marker. So I'll just kind of draw a bit of a circle here, 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 and here, just so it can kind of stick out a bit more. Okay. So what did I say? I said TPAM. You have your tricuspid. Between the right atrium and the right ventricle, the blood has entered. This is the starting point. Where are we going? We're going through our tricuspid, okay? Our tricuspid valve. The way I like to think of it is, there's a bit of a memory way, but I like to think, so let's just say our right tricuspid, the RI stands for right. It's on the right side, okay? Great. Next thing, what is it going to be? We're going into your pulmonary trunk. So which valve do you think this could be? It is a pulmonary valve. Your pulmonary valve is going, and it's going to bring your, when it opens, your blood is going to the rest of the pulmonary trunk, off into your pulmonary arteries, off into your lungs. Great. Next one. Next one is not technically in order, but just for the sake of let's go across, I'll draw it here as well. So T, P, A, M. Next one, just because we're going from right to left, it is your aortic valve. Your aortic valve, it is going to go and stop the blood from going into the aorta, or it'll open. Blood goes into the aorta. Great. We're off into the systemic circulation, off to the rest of the body. Now, next you have your mitral valve. So your mitral valve, you can also call it the bicuspid valve. It's just another name for it. So you could either say, if you do prefer to call it the bicuspid, you could say TPAB. If not, let's say TPAM, mitral valve. Great. Okay. So rule of 4. We've covered the 4 main chambers, or the 4 chambers, the 4 vessels, and now we've covered the 4 valves: TPAM, tricuspid, pulmonary, aortic, mitral. Like I said, probably in future videos I'll try and get a few different pens, inshallah, God willing, so we can make it maybe a bit more distinct. But great, we've now talked about essentially a bit of an overview of the heart anatomy. So thank you very much for watching, and great.